EGM Network.
Hi, welcome to Silver Linings. I am your host and co-host today with Raul Perez, who is with me. And in the studio, we have the team from Encompass Rehabilitation Hospital joining us. And they are going to discuss topics that impact our community at large, not just their patient base, and how you and your loved ones might benefit from some of the things that they're doing at the hospital. In the studio with us is Ashley Call. She is the Business Development Director here at the Treasure Coast location for Encompass Rehab Hospital. And we have Megan Erentreich, who is the lead liaison as well here on the Treasure Coast. They might look a little familiar to you if you are out and about or if you work in any of the clinical settings. And we're very lucky to have you both with us today. Thank you.
Thank you so much for having us.
Thank you.
Indeed, indeed. Now, I work with a lot of the population in our community, and we see a lot of things that go on. I know Raul has a lot of private meetings with his client base, and one of the common conversations is, what do we do after an emergency, after a trauma? What are our options? And better yet, who's actually vested into our communities that we want to partner with them, not something fly by night, right?
Right. I see a lot of elderly. That's who I help with their estate planning and other needs. And normally, sometimes they have injuries, they need rehabilitation, they need services. And that's something that, we can inform the community and give them more information so that they can know their options.
Yay. I know that it's a general conversation in a lot of households. So thank you again for joining us. And before we delve into some of that conversation, our listeners want to know more about Encompass Rehab Hospital. Can you tell us a brief history? I mean, I know it could go on for a while, but if you could tell us a little bit about how long has Encompass been here? What is the population they serve? What are their primary goals?
So the Treasure Coast location is one of our legacy hospitals, actually. It's been around for over 30 years. We have 160 locations in the United States, with 5 new ones opening in the state of Florida alone this year, with the first one opening this quarter. So it's exciting. It is a huge hospital. We are known as the trusted choice because we have been around for a long time, and all we do is inpatient rehab. We specialize in getting patients their independence back so they can return home. So
you said something that maybe our listeners don't understand. So tell us a little bit about what specifically do you mean by inpatient rehab?
So inpatient rehab, and since we're a hospital, we have like a specialized license. We have physician oversight. So we see a physician 3 to 5 days a week. The patient will see them. We have a PM&R, so physical medicine, rehabilitation doctor, and also internal medicine. We have 24/7 nurses, our own pharmacy. So that's really what stands us apart as far as being a hospital. And patients go for the acute care hospital, they get a diagnosis, and we basically carry on the treatment. So we take stable patients and we give them their independence back so they can return home to the community. That's what really stands us apart from other, maybe a nursing home that has rehab services.
Right. So they're getting that clinical continuation of care when they're at Encompass Rehab. And so a lot of people, they get better, they've stemmed the bleeding, so to speak, in an acute setting, but they still have challenges, right? Exactly. So that means they come in and they stay with you all a little bit longer. I know for some of your families, that's really important because they might have children that are up north, and they're not sure if mom and dad are really ready to go back home. And so this adds that whole other level of comfort for them. And I know that because we have conversations about that.
And we do have an app too. So that's a good thing about Encompass as well, is that we want the families to be able to track their progress. So when they come inside, if they have a family that lives in New York, they can track their progress on the app. Then they also get a case management team. So we're admissions, obviously. We get the patients into rehab, but we have a case manager team that sets them up for post-discharge. So if they do need like private duty or they need home health care, we continue that on. If they need any devices, or if we feel like maybe they need private duty to come in and help them and assist them, we'll get them all listed. Or maybe they need to go to assisted living, we can start those conversations in-house as well. So our whole plan is to get our patients back to their community, whether that's home, whether that's to an assisted living, wherever their home was prior. That's what we want to do for them.
I like that. I'm sure the families do as well. You're
So
awfully quiet in that corner over there, Miss
let me
Megan.
actually ask a question. I'm sure you have seen this, Janine, where most of my clients would rather be home than in a hospital.
Mm-hmm.
And that's as soon as they get in, they say, how quickly can I get back home?
Mm-hmm.
So how do you talk to them that it's probably a better idea to go to Encompass and get the in-hospital care than to go home?
And that's where we educate the patient and the family members too at the bedside or wherever it may be. Encompass Health for inpatient rehab, we're a short-term rehab hospital. So the typical stay is 7 to 10 days. We always tell our patients too and the family members that they do much better in that time, we'll work on getting you out sooner. But it's really the short term for the long term. We stand out differently than a nursing home per se, where the typical stay is 21 days plus.
Ooh, big difference.
Very big difference. So
Wow.
It's something that we really do have to educate the family and the patients to let them know, like, hey, yes, you're going to come to us for a short amount of time to get back home to where you used to be, but you're not ready to go there yet. Because our biggest fear is when they go home, because that's what they want to do, and they don't make it at home because they're only given, for example, at home health, maybe 1 to 2 days of therapy a week for an hour. And it's just not enough to build up your endurance and your strength back up to get where you used to be.
On that, what do they say about individuals? So you get people, I understand, that maybe have been in the hospital for 2-3 weeks for an acute situation. They're getting better. But what happens to their stamina and strength during that time frame?
Yeah, so typically when you're in acute care setting in a hospital, they always say statistically that every 1 day in bed, it's an extra 3 days of rehab that you need to get back because you're not doing much there. The therapy that you're given in the hospital is not as much as that you would come to our inpatient rehab. So it does take a while to build back that endurance and get your strength back up at whatever it may be because you've just been in bed for so many days.
And it's great, too, because Megan and I are both therapists. So we had the luxury of working in those different settings. So we worked in a hospital setting, acute care hospital. That's my background. Megan's worked in nursing homes. What other settings have you worked in?
Acute care, outpatient, as well as inpatient rehab as well.
And I also worked at inpatient. I worked at Encompass as a therapist there as well. So we know firsthand like the difference between. So sometimes it's just education with the families because we know everyone wants to go home and we want them to go home. We want them to go home and stay at home. So we're giving them that opportunity to not just make it home, but to thrive at home. And I think once you educate them on that, then they're like, okay, that makes a lot more sense. And it's 7 days. 7 days are going to pass regardless, and you might as well come there, get the rehab you need so you can really be successful at home.
I love something you just said. You pointed out that both you and Megan have been floor therapists. So you have this unique insight when you're interfacing with clients, when you're talking to them about what to anticipate when they're coming into your setting for care. Is that a common thing at Encompass Rehabilitation Hospital?
It is. They really thrive on promoting from within. They thrive on utilizing whatever your talents are. So I started there as a student in 2018, and I always wanted to work for Encompass. I love their motto. I love that I got to see patients at their lowest and come out like independent. I love that. It gives you such a great feeling. So I came back in 2020 as a therapist, and I moved over to admissions in 2022. And then I quickly advanced to the business development director. And same for Megan. She was my rehab liaison for a year, and she promoted to senior. So we really do believe in promoting from within and taking our talents and, allowing them to grow. And if you want to grow, it's a great place to grow and a great company to work with.
I like that. I like that a lot. Raul, when your clients and your families call you and maybe they've had a trauma like a stroke and they go home, do you get phone calls after the fact that say, hey, things aren't looking right, we're concerned, what options are out there? Do you ever have those kind of conversations with your families?
So there are times where I have clients who are very independent, and not that they don't want their family to know, but they want their privacy.
Correct.
So
I understand that.
In those situations, the family might reach out to me because they know of me, and there's really a limit to what I can say because of my job.
Correct.
But when I have families that are more connected, and I have children who are more involved in their parents' life, then yes, I will get, hey, I have a concern, and is there anything that you would suggest? So, I mean, I think those are instances where I normally would tell them, well, you might want to have a family conversation, get together, see what options there are to try to help mom or dad or brother or sister. And just going back to what you were saying, that the average stay is 7 to 10 days. Once they leave Encompass and they go home, how does that look like? Is there a follow-up? Do you guys communicate with them and check in and see how they're doing? How does that work?
So you will get a case manager team, and they will discharge you, and they'll set up like home health and things like that. And they'll also schedule like doctor's appointments that you may have, and schedule a doctor's appointment with your PCP. So we won't necessarily check in with them, but they obviously have our cards or anything like that if something happens. Sometimes they will get home and maybe they'll say, well, I don't feel like I'm doing as well at home. Or, for instance, someone will go home and next thing you know, they have the flu or something like that. And they'll say, well, I'm declined again. So then at that point, they may call us and say, hey, can I come back to rehab? So we have gotten those conversations and those calls. And, we've actually gone out to their home and done an assessment and got them back into rehab. So they have all of our contact information. They go home with the case manager's information. So if they do have questions or they need a follow-up, they can give us a call.
Now, hold that next question or any additional questions, because we do have to take a small break. But you just touched base on the next topic for when we return. And that's what happens after you've left and what is your connection back to the hospital. So please, for now, just give us a moment. We're going to take a short break. Thank you.
My name is Mike Conway, and I'm with Royal Fund Management. We want to revolutionize your workplace retirement system. The recent Secure Act 2.0 legislation has opened the door for pooled employer plans, better known as PEPs. Learn how a PEP can revolutionize your 401k. Call me, Mike Conway, today. I'll give you a free benchmark of your current plan or set up a new plan. Visit secureact2info.com. That's SecureAct, the number 2, info.com.
Investment advisor representative of investment services offered through Royal Fund Management LLC, an SEC registered advisor. 401k maneuvers and other business for Royal Fund Management.
Big news, Treasure Coast. Your favorite mortgage team just got even better. Introducing the same trusted faces you know and love, now with Union Home Mortgage.
Hi, this is Shannon Pohl.
Hi, this is Lucy Cranker.
And these high-producing team members bring decades of experience, unwavering honesty, and hearts of gold to every home loan. And here's the best part. Same local processing, underwriting, and appraisers you rely on. Contact Union Home Mortgage.
Visit us online at shannonCpohl.com
and LucyCranker.com.
Our breaks are always short and sweet, but I'm thoroughly grateful for our commercial sponsors. But before we jump into the topic at hand, I do want to give a personal shout out to our show sponsors, to the legal team over at Rooney & Rooney in Vero Beach, as well as the financial team over at Conway Financial Planning. If you should need any of those services, please don't hesitate to reach out to them, for without them, Silver Linings wouldn't exist. All right, so back to the conversation, because we were just starting to get into the thick of it, right? So we know people go for rehab, and we know that they have set goals, right? I want to be able to walk again. I want to be able to safely get in and out of my vehicle again. I want to be able to dress myself or bathe myself, because, those are basic things, but sometimes people are significantly challenged and have to rebuild that ability to do that. And then say 7 to 10 days have gone by and you get that discharge and you go home. Mm-hmm. And as you alluded to, sometimes you get home and other things occur or new challenges arise, or maybe you actually have achieved your goals, but you still have some concerns and you feel a little bit alone with your most recent diagnoses or challenges. And what options do they have, and that they can possibly stay connected to the hospital?
So we do have 2 support groups. We have an Amputee Support Group and a Stroke Support Group.
Ooh, now both of those are big topics and big challenges for anybody. Yeah, okay, I like that. And when I meet people in the community and they've had strokes, it's almost like a war story, right? Because they're all different. None of them are exactly the same. There's a variety of strokes. There is a multitude of potential long-term impacts from those varieties of strokes. And not to mention the opportunity for rehabilitation and how they're all approached differently, right? So tell me about what you all are doing with the general public. Are these groups just for your patients?
No, they're actually open to the public. And I really like what you said, because it is a journey. It's a journey for those patients. You know, you don't have a stroke and then you just bounce back from it. Some people will bounce back, but some people will have lingering side effects and they may need support. So it is open to our population. It's for the caregivers as well, because the caregivers are just as important, because they're going through this illness with their loved ones as well. And we also bring our patients down. So you can come into our hospital and rehab there, and you can come down for the support group. And it's basically giving you a support system. Is giving you people that are also going through the same illness and the same diagnosis, and they can assist you in your road to recovery. And they can tell you that you're not alone. And, you know, I think that's the biggest thing. You know, if someone's going through something, they want to know someone also has been through this and they made it to the other side and they've gotten their life back. Because for most people, it's fresh, but for some people, they've dealt with it for a long time, and giving them that person to connect with. Because we know sometimes it may not be the therapist that you're connecting with. It may not be the doctor you're connecting with. It's your peer. You want a peer that also can relate to you. And that's what we're giving them in the support groups.
Right. I mean, you want to know that the mountain is climbable.
Exactly.
Right. And it's a rare occurrence that anybody goes up on those big mountains into the snow without knowing somebody else has already done it.
That's true.
So the stroke group, what is a general description of what might occur in one of these stroke rehab groups?
So we have one of our rehab liaisons who actually was a therapist at Encompass prior. She hosts both of these support groups, but she has a really good following as far as a lot of prior patients that come in. And they really just kind of talk about their journey and what they've kind of overcome, or their barriers that are still there. And then we're also working on bringing some guest speakers coming into our support groups coming forward, whether they're stroke physicians in the hospital or whatnot. So it's a variety. Each one is completely different, but it's really just a support group with those who have been with us prior, but as well as like bringing those in from the community that have heard about us.
And we love feedback from the community as well, and feedback from the people that are attending. And what would they like to do? And what they were saying is more so they want to hear some physicians and maybe some of the side effects from a stroke. If they have dysphagia, maybe bringing a speech therapist in there. If they have some gait disturbances, maybe having a physical therapist in there. Maybe they need to do like dressing and things like that. Maybe it's something that they can implement in their, compensatory techniques and things like that. So just really listening to the feedback from the people that are attending. What would they like to do? So that's what we're trying to do, make it more focused on what they want from us. And I think next month we have a really exciting one coming up, and an exciting one for May, which is Stroke Month. So
I was going to say, isn't May coming up? And May is a big month that is a National Stroke Month, and a lot of people recognize and highlight strokes and the challenges that come with it. I'm excited to see what Encompass Rehab is going to be doing in May. Yes. But yes, I actually have had the pleasure of going to one of your groups. So I apologize. I was just asking because I wanted you to explain it. And I was blown away by the camaraderie and conversation that the different individuals had. Not a single person there had the same kind of stroke. They all had different challenges, and I was blown away at how helpful they were to one another, and apparently how they all mostly have each other's phone numbers, and they communicate and they go together and they make plans to attend together. That is amazing to me, and it says a lot about the fact that it's working. It's working. You're building a community for them specifically. What day of the week is that stroke group?
It is the second Thursday of each month from 4 to 5.
Oh, okay. And so they can anticipate coming in, maybe having a speaker and some camaraderie. Now, I know that that is not your only support group, right? You have another support group, right?
Yes, we do. Our Amputee Support Group.
Okay. And now that's a hard one, I bet, right? So they've had to come to a lot of realities and changes in their lives if you have an amputation. Tell me a little bit about what something like that might look like for somebody coming inbound and how they might benefit from coming to a group like that.
So for that one, we actually have a guest speaker every single time. His name is
Paul Warner.
Paul Warner, yep. And he is one of the prosthetists in town. And what's interesting is that normally he'll make the prosthesis for the patients, and he'll kind of educate them on the support group that we have at Encompass. And it's just a good way for all of his patients and all of our previous patients to come in and be supported by him, as well as our therapist in-house and whatnot. And then also talking about, again, barriers that they continue to have or overcome, things that they have overcome since they have gotten the amputation and gotten their prosthesis fitted.
And it's nice because we bring them in for after they get the amputation, we can bring them in for stump training. We can bring them in to show them how to, skin protectors, how to transfer, and then they can go home after they feel comfortable with that. And when they're ready, they have their shrinker, they have their prosthetic, we can bring them back in for prosthesis training. So it's nice. So we are on the journey with them their entire time and the entire step of the way. And a fun fact, I was in a car with one of the liaisons that hosts the group, and we got a call, and a patient was scheduled for a surgery. He hadn't had a surgery, and he wanted to talk to someone about support, but he didn't want to talk to a liaison. He didn't want to talk to a doctor. He wanted to talk to someone else that also had an amputation, because he wanted to know what to expect with his amputation. How is your life now? How are you able to transfer? Are you back in the community? He wanted to actually talk to someone. So we were able to call someone who's been a good supporter of the support group, and we gave him the number. And next thing you know, the guy from the support group actually went to see the patient in the hospital before he had the amputation, after the amputation, and now they're still good friends, and they both attend the support group together.
Wow, mentors growing out of the support structure. I love that. I love that story.
And with what you mentioned, I think it's important because, for example, my clients, to get them in the office is one thing, because they normally don't want to talk to me, right? When they have to talk to me, there's either a problem or they need to find a solution. Same thing with you all. You're trying to find a solution to their problem. But sometimes they don't want to talk to an attorney. They don't want to talk to a hospital staff. They want to talk to somebody who has been through what they've been through.
Yeah.
So these support groups can give them that. And unfortunately, just because you have one stroke doesn't mean you might not have another.
Correct.
So these support groups sound like they can help these people, get more knowledge, have friends that they can talk to build up their strength and their courage to say, all right, let's get better. Let's make sure this doesn't happen again. So it's great that you have these different groups that can give, these people someone else to turn to other than professionals who have been through what they've been through.
Exactly.
Kind of like when you're a kid and your parents tell you don't do that, but when your friend's cool mom tells you not to do it, you actually listen, right?
Right.
Yeah. I've seen that come to life in my life. I don't know about that. Well, that tells us a lot about Encompass Rehab, because it sounds to me that it's more than just the person that's in the hospital. It's the community at large that's garnering relief and education through it. So what day of the week is the amputation, the Amputee Support Group?
It's the third Wednesday of each month from 5:30 to 6:30.
Nice. So once a month, these individuals can come inbound, get some camaraderie, get some education, learn some new information, be aware of new statistics, how it might impact a future, scenario that might involve them or a loved one. I love that. So what do they have to do to actually come?
They can just call. They call and they just let us know that they would like to come, and then RSVP, and we'll get them on the list.
I love that. So it's just dial the digits. That's it.
Dial the digits.
So our producers put up on our screen for those of you who are looking to make a call and join the Amputee Support Group or potentially the Stroke Support Group. Give them a call on that 9802 number and let them know you're coming and have a spot saved for you. Apparently there is a spot for you there. So make sure that you reach out. Thank you so much, Ashley. Thank you, Megan, for joining Raul and I and sharing the information. Silver Linings is all about solutions, and we are grateful for the solutions Encompass Rehab is providing in Indian River County. Thank you.
Thank you so much for having us.